want to tell about this gene, anaplastic lymphoma kinase gene. During our childhood, in the womb, what happens? This gene is there in the womb, and it is a helpful gene. अगर ये जीन ना हो हमारा ब्रेन और GIT डेवलप नहीं होगा. So this is responsible for the development of our brain and our GIT. And what happens? Then it turns off. Gene बंद हो जाती है. It disappears from the womb. By the time child delivers, the gene is not there at all. And suddenly, in the later stage, it reappears. So then, this ALK gene reappears. Again, you harm नहीं करेगी until unless it fuses with another gene, EHL4 gene. Once this fusion occurs, we call it fusion or we call rearrangement. Then it becomes an oncogene. Once it becomes that oncogene, only then this tumor arises. Not only that, it is also seen in neuroblastoma as well as in large lymphoma. The large cutaneous lymphoma also, this gene is present, and there also. But what was discussed here was that we only treated patients who were in the stage 4 disease because we are not able to track in earlier stages. The reasons are obvious because number one, this is the only lung cancer which is present in non-smokers. हम लोग target, so there is no risk factor at all. Neither it is seen in patients with asbestosis, neither it is seen in patients with air pollution. So there is no correlation with atmosphere. It is just our bad luck that this mutation suddenly occurs. Or neither, like other breast cancer and other tumors where BRCA gene is there, which is genetically transmitted. There is no genetic transmission of this gene. This is sudden appearance in the adult life. And another thing is that this is the only tumor which is present away from the respiratory tract, in the periphery, not in the nearby alveoli, not near major tract. So by the time it reaches the central area of the lungs, it becomes symptomatic and patient will have cough, hemoptysis, and then it is stage 4. So we are not detecting at all in first, second, and third stage. But in America, there is a definite screening program. As you told, Dr. There is a liquid biopsy, immunohistochemistry, and this is a regular program of screening because we are dealing with stage 4 disease. Only plus point is that once we detect, as you told that this AKL targeted tyrosine kinase inhibitors are very effective. Targeted therapy, very effective as was discussed here. At least once it is detected, average 5 to 7 year life is there. But that is the only plus point that once we do this diagnosis of this gene and then start this targeted therapy, the response at least 5 to 7 years survival is there. But how to detect it in the early stages, it is not possible. At least in India, it is not possible.
So low dose CT scan is done. Low dose CT scan is done as a screening.
Only for smokers.
High risk.
That is what Sir was discussing.
But smokers it is not present. It is not present. Neither it is present in females.
But it can be done as a screening.
No, it is present in younger age group.
In India, the low dose CT is not recommended.
It is present in the younger age group, less than 40 years, less than 50 years, in females, in non-smokers, in no risk factors.
जिसका risk factor नहीं है
जिसका risk factor ही नहीं है कहाँ detect करेंगे इस disease को? So it was a very important aspect. What I discussed was other aspect, non-therapeutic part of the aspect, which is a really social problem for us because this mutation, this oncogene between two genes, which are just by chance. So we have to, in India, we have to got a long way to go. But only plus point is that at least once diagnosed with these tyrosine kinase inhibitors, we do have a 5 to 7 year survival rate, which is fair enough, I think. Particularly if you compare it with other